Hello, everybody, and have a good time. I hope all of you are fine, and we start 17 monthly webinar on Mizaj research by a presentation of my dear teacher, Professor Rashid Bhikha, and we start by introduction of Dr. Danishvar. Some minutes about my dear teacher, Professor Rashid Bhikha, and then we will use his presentation about Mizaj questionnaire that they developed in South Africa, and then we discuss about their work there and the needs of the standard tools in the diagnosis research in Unani and Persian medicine. Dr. Danishvar, already, please, if you are ready, please tell some minutes about Professor Rashid Bhikha, introduce him, and then we start his presentation.
Thank you so much, Professor Mujahidi. Hello, everybody. We are so pleased today for the presentation of Professor Rashid Bhikha today. I think he will start with a short introduction about his career and his institute, and after that he will describe some more explanation about the temperament determination and its questionnaire, which have been developed in his institute, and its different items that we are going to be more familiar with his method. I think we can now be at the service of Professor Rashid Bhikha. Professor Rashid, we are hearing your presentation. Thank you.
First of all, I want to really thank the whole committee who started this Mizaj research, Dr. Danishvar, Dr. Mujahidi, etc. It's an excellent initiative. Inshallah, may Allah subhanahu wa ta'ala give us khair to develop, because temperament of Mizaj is such an important concept in the basis of Unani. So without much ado, Bismillah ar-Rahman ar-Rahim, let me start with my presentation, if that's okay. Okay, can everybody hear me? Am I clear enough?
Yeah, please.
Yes,
Okay.
please, Professor.
Okay. Before I begin, I want to just give you an overview of my journey to Unani Persian medicine. Background: before my journey, qualified as a Western trained pharmacist in 1969, established Bhikha Pharmaceuticals in 1974, the first non-white pharmaceutical company in South Africa, which went sold in 2007, was the largest privately owned company in the country. The initiation of my journey to Unani Persian medicine, my journey began in 1990 when my youngest 8-year-old daughter experienced severe breathing difficulties. This continued for a few months while being treated with bronchodilators and antibiotics. Her condition of fibrotic enteritis was diagnosed after a lung biopsy requiring oxygen continuously. The pulmonologist informed me that the cause of the hardening of the alveoli was unknown, and the daily dose of 50 milligrams prednisone was the only possible treatment. This made me realize the limitation of conventional Western medicine, where there is limited understanding of the causes of illness conditions. More concerning were the side effects associated with cortisone. Thus began my journey to research other medical paradigm systems and alternate systems such as Unani, homeopathy, Chinese, aromatherapy, etc. I also completed a course in Ayurveda for health professionals that was established by Deepak Chopra in South Africa in 1991. Being anxious to learn about Unani medicine, the only book that was available in English at the time was the Kim Chistic book, you can see on the side, Traditional Healer, Guide to the Principles and Practice of Unani Medicine. After reading this book, I followed up with an online course in Unani Herbal Healing that was offered by Kim Chistic American Institute of Medicine which I completed in 1992. Now, the decision to focus on Unani, after having researched the different systems and being trained as a pharmacist in Western medicine with roots to Hippocrates, who we all know is the father of medicine, and also the Greek Unani elements of creation, earth, water, air, and fire, as opposed to the elements in Ayurveda, earth, water, air, fire, and space, and Chinese medicine, earth, water, fire, wood, and metal, which is keeping with the Abrahamic scriptures of the Torah, Bible, and the Quran, facilitating my choice to learn and promote Unani medicine, Persian medicine, as my future career objective. My decision was also influenced as a member of the Islamic Medical Association in South Africa since 1980, and being aware that during the golden Islamic age, Greco-Arab medicine was also known as Islamic medicine. In 1994, I visited Hakim Said at Hamdard University, Pakistan, to request the development of a similar course I completed in Ayurveda to promote Unani in South Africa. After my visit and being inspired by Hakim Said, I established the Ibn Sina Institute of Tibb to promote the practice and training of Tibb or Unani Persian in South Africa. The reason for choosing the name Tibb instead of Unani was influenced by the establishment of democratic South Africa in 1994 with Nelson Mandela as president. This ended the colonial and white apartheid rule of more than 3 centuries. Introducing this medical system as Unani, a foreign term, would not have been well received. Choosing the name Tibb, Arabic word for medicine, would be linked directly to the founders of medicine, Hippocrates, Galen, and Ibn Sina. And also the name Tibb provided a differentiation from conventional Western medicine and also allowed incorporating current medical knowledge in the form of integrative medicine. For the training at Hamdard University, Pakistan, in November 1997, together with a primary healthcare nurse and a medical doctor, I attended an introductory course in Unani medicine. During the course, I realized that the approach of training in Unani will have to be changed to suit the Western environment of South Africa, where Western medicine is dominant. Arrangements were made with Hamdard University for Hakim Abdul Haq, an expert in Unani philosophy, to join the institute, which he did in November 1998. With the presence of Hakim Haq and researching other Unani sources, I was introduced to the Unani philosophical principles, which include the following: the 7 constitutions of man, Arkan, Mizaj, Akhlaq, Aza, Arwa, Quwa, Afal, and secondly, the Sita, the Durya, the 6 essential lifestyle practice, and of course from the whole practice of Tibb, one of the most important concepts is Tabiya, 5 known as the body's inherent wisdom of healing. Accepting the terminology of the above philosophical principles, and more particularly the description of humors as hypothesized by Hippocrates, including Damavi or blood, was of concern to me because of the confusion it may cause in that Western environment where the word blood is known to consist of plasma, different cells, blood vessels, etc. I also realized there was no correlation between the terminology of humors and temperament, as mentioned by Galen. In addition, I also realized that there was no relationship between the principles of Mizaj, Akhlaq, Sitra, Zaruriya, and Tabiya. So, the strategy to address the concern, after much thought and being aware of the recognition of Hippocrates as the father of medicine in the South African Western environment, and being inspired by his famous saying, it is more important to know what sort of a person has a disease than to know what sort of disease a person has, which highlights the uniqueness of the individual, obviously known as Mizaj temperament, which provides valuable insight into an individual's predisposition to illness conditions. Researching the identification questionnaires of Mizaj temperament evaluation was one of the main objectives of the Institute since 1998. Achieving this objective of identifying Mizaj within the context of a one-size-fits-all approach in Western medicine would be an excellent way of promoting this system of medicine in South Africa. To achieve the objective of completing the Mizaj temperament questionnaire, the Institute obtained necessary references, resources, and having completed my course in Ayurveda, my first reference was Deepak Chopra's book, Perfect Health. Now, if you look at the book, I certainly am not going to go through every criteria because we went through so many. But if you look at the Vata, I perform activity quickly. I'm not good at memorizing. I'm enthusiastic. Now, if you look at Ayurveda, they've got 3 different discovering of body type: Vata, Pitta, Kapha. The adjacent slide is an example of the criteria of identifying the Vata body, which is similar but not exactly to Sravi. The criteria for Pitta and Kapha have also similarities to Sapravi and Balgami. Having done the Ayurveda course, I was aware of, first of all, that 1 dosha, 2 dosha, and also 3 dosha type combinations. In other words, people can have 1, 2, or 3 different types of doshas in one individual. Next slide. Now, if you look at this one here, this is an adjacent slide. Also, if you look at the book Unani-Tibb Medicine, the adjacent slide describes parameters to identify the 4 temperamental types: sanguine, phlegmatic, bilious, melancholic. Again, if you look at parameters, complexion, touch, hair, movement, etc., etc. But I've got so many slides, I'll just quickly go through them all. Go to the next slide. This one here, the 4 temperaments. Now here again, if you look at the different ways of assessing them, universal element, standard qualities, etc. The adjacent slide is an example of criteria quality of the 4 different temperamental types: choleric, which I prefer to use, bilious, melancholic, sanguinous, and phlegmatic. And we go on to the next slide. Now, looking at this one here, this is a book by, very interestingly, a book by Lale Bhikha, known as part of God's Will Be Done. Very interesting in this book, there's the document, the slide there. The adjacent slide describes the 4 Mizaj temperamental types in relation to the zodiac sign. That highlights the importance of personality in identifying a Mizaj temperament. Now, from the research that you've done, if I look at myself, born Virgo, it was cold and dry. Okay, so it just shows to a large extent that this whole approach was also giving a pretty good idea about the different temperaments. But the important thing is focusing on the person's personality traits. Next slide. Now, this poem was one of the most inspiring poems for me. This is a book by Florence Latour on the poem. I'm sorry. Quickly, sorry. Folks, I'm sorry, there's a bit of a problem here. It's lighting and things like that. But anyway, I'll carry on with that. So it's in this slide here, you see, like, where she describes God, man, or sanguinus, people with lots of fun and accomplishment. And person, melancholic, organized and chartered, choleric, etc. But we need each temperament for the total functioning of the body. The poem above describes the personality traits of the 4 temperamental types, highlight that each person will have a dominant temperament, less of a second, lesser of the third, and the least amount of the 4th temperament, resulting in each person having a dominant and a subdominant temperament. Okay. Now, an overview of the resources. You can see that all of them have got some aspect of physical appearance, some tendencies, predisposition to illness conditions, personality traits, extrovert, introvert, etc. Elaborating on the physical appearance invariably changes with age, where tendencies and predisposition, illness conditions are relatively stable up to middle age. So the above categories, the personality traits which reflect person characteristic patterns of thought, mental, feeling, emotional, and behaviors is ultimately the most important criteria to determine Mizaj. Next slide. Now, the hypothesis of identifying each person as a dominant and subdominant Mizaj. As mentioned previously, Mizaj, dosha, body type in Ayurveda acknowledges the presence of combinations of different doshas, Vata, Pitta, Kapha, as well as the individual's overall dosha or mizaj. In addition, also mentioned in the poem that was lecture, we need each temperament for the total functioning of the body, highlighting the combinations in mizaj. Within the context of the perfection of creation, Allah subhanahu wa ta'ala, and yet opposite qualities cannot exist simultaneously. We all know nothing can be hot and cold, nor moist and dry at the same time. The Institute hypothesized that an individual's temperamental combination will have a dominant mizaj, a second subdominant mizaj that will be adjacent to the dominant and not opposite to the dominant mizaj. For example, if you look at the slide on the side, a person with a dominant Umawi mizaj with hot and moist qualities will have a subdominant of either Safrawi or Burgundy and not Sudawi, because the Sudawi is cold and dry, whereas the person's dominant is hot and moist. So obviously, this is why we hypothesize that the person's dominant and the subdominant will be next to each other and not another person. Based on the above hypothesis and these sources to identify criteria for Mizaj temperament, the Institute developed its first Mizaj questionnaire divided into three broad categories: physical appearance, tendencies, and personality traits. Now, the Institute's first Mizaj temperamental questionnaire. The above Mizaj questionnaire was included in our first Institute book, Tibb, Traditional Roots of Medicine in Modern Roots to Health, published in 2000. So as you can see, sanguineness, or physical appearance, tendencies, personality. So each one was broadly categorized into these three broad categories. Let's go on to the next slide. Now, the terminology in the Institute's first book, this is very important. Institute's first book, Tibb, Traditional Roots of Medicine in Modern Roots to Health, also addressed the concern with respect to the terminology of the word Umawi blood. Secondly, the link between the names, terminology of humors and temperament, and also the relationship between the philosophical principles of Tabiya, Akhlaq, and Sitta Zurriya. With respect to the differences of the terminology between humors as mentioned by Hippocrates, blood, phlegm, yellow bile, and black bile, and temperament as mentioned by Galen, sanguine, choleric, melancholic, and phlegmatic. It was decided to use the same names, sanguine, Umawi, phlegmatic, Burgundy, melancholic, Sadawi, and Buddhist, Safrawi, for both humors as well as temperament. Instead of using Galen's description of choleric, the name Buddhist was considered to be more appropriate to yellow bile and the hot and dry qualities associated with the Buddhist, Safrawi, Mizaj. With respect to the relationship between the different philosophical principles and the identification of individual temperament, and more so the dominant quality providing insight into the relationship between the principles. If you look at the picture on the side, at the core of Persian Unani philosophy is Tabiya. While the individual mizaj is fixed, Akhlaq fluctuates constantly from the qualitative effect of Sitta Zurriya, especially diet. This influences the immoral balance qualitatively and quantitatively. The inability of Tabiya to restore homeostasis invariably leads to pathological processes and illness conditions. Right, now let's go more onto the question, on traditional questionnaires. Now, since 2000, the Institute started the consumer training of individual approach to healthy living. And in here, the Mizaj temperament questionnaire, based on physical appearance, tendency, and personality trait, was amended with additional guidelines to determine Mizaj as per the slide. Here we just give more guidelines that each person is a combination of all four dominants of one temperament. In fact, common to feel that you could almost put into one or other. This is your subdominant. Now, like this here, from 2000, we have different criteria for evaluating temperament. Let me go on to other slides. Now, this is, now the previous one were three categories. Then we fine-tuned it a bit more. The consumer workshop conducted from 2000 onwards confirmed that each individual temperament is a combination of a dominant, subdominant Mizaj. with each individual having an overall dominant quality. Identifying the dominant quality facilitated the workshop to include a personalized lifestyle program in relation to the city of the rural lifestyle effective for each patient. So as you can see here, initially we had 3 broad categories, then we broke it down into quality, frame, gait, complexion, range, climate, food and drink, etc. I'm going to the next slide. Now the qualities associated with temperament. After running these workshops and doing so much research, and in addition to facilitating an individual's lifestyle program, the picture below includes the qualities associated with the different mizaj and also includes an individual dominant quality. The diagram lists the 4 different mizaj types with their respective qualities. Okay, in other words, Damawi, Burgami, etc. Now, and also indicate the overall dominant quality associated with the individual temperamental combination of a dominant subdominant temperament. For example, a person with a combination of a sanguineous, Damawi, and Sapravi temperament will have overall dominant quality of heat, less of moistness and dryness, and the least amount of coldness. Similarly, a Burgami Sodawi temperamental type will have a dominant quality of coldness, less of moistness and dryness, and the least amount of heat. The dominant quality associated with an individual's temperament provides us insight into the predisposition to illness conditions having similar qualities. For example, a person with a sanguineous phlegmatic combination with the dominant quality of moistness will be predisposed to clinical disorders where moisture is the dominant quality, such as type 2 diabetes or phlegmatic asthma. Now, the training of Unani-Tibb doctors established by the Institute in 2003 at the University of the Western Cape at both a 5-year undergraduate degree and a 1-year postgraduate diploma. In the training, I included a research module aiming at validating the temperamental and humoral theories. In fact, in the 2003 postgraduate diploma course, the relationship, the research of the relationship between clinical disorder and temperament was included in my PhD, African Renaissance in Health Education, developing an integrated program of Unani-Tibb training for healthcare professionals in South Africa. This is shown in the next slide. Relationship between clinical disorder and temperament in the 2003 PhD. Now, if you look at already, if you look at, say, diabetes, 100% of them have a dominant, subdominant sanguineous temperament. Asthma, of the 12 asthmatic patients, 83% had a dominant, subdominant phlegmatic. So like as you go all the way down, let's look at the summary. From the above table, it is apparent that in all illnesses, there was a significant range percentage, ranging from 66 to 100% of patients with the same dominant, subdominant temperament. This suggests a definite relationship between the patient's temperament and the clinical disorder. Okay, now again, at UWC, while I was in charge, I made sure that the research projects were conducted to actually validate the hypothesis. Now, here, this is ethically approved research that was conducted. And now, let me explain. Additional ethically approved research assessed the relationship between the qualities associated with the number of chronic disorders and temperament, conducted in 2006 by 27 students on 2,151 patients, which confirmed the link between qualities of illness conditions in relation to patient temperament. Okay, now if you look below, this is a link. It's all available on the Institute website. Let's go to the next slide. Now, the Mizaj Questionnaire for Unani-Tibb doctors in 2003. This questionnaire for the training of doctors that commenced in 2003 was amended into 2 sections, A and B, and also included guidelines. Now, Section A can be assessed by the doctor, where Section B will require patient participation. When completing the category of frame in Section A, remember the patient's frame may be altered due to slimming, aging side effect. Shaking the patient's hand can provide various clues of the skin texture and quality. The personality and emotional trait in Section B, an important indicator. However, do remember this category should be considered considered for the patient under normal circumstances and when he or she is not stressed. Again, yeah, this is just one example of the different criteria that we had over the number of years. Right. Yeah, there's another one criteria in our questionnaire in our recipe book of 2003, Cooking for Your Body Type. This is a recipe book for the different temperamental types. My daughter, here you can see again the category. Here we also had eyes, we had memory, emotional. Now we tried different things at different times. I'll show you another one. This is another questionnaire that we had in my book, 4 temperament, 6 lifestyle factors. Okay, so as we went on, we tried different criteria to see how it worked. All right, let me carry on. And then this is a questionnaire included in a school training in 2006. The Institute developed its school program that was launched during the Promoting Health in Schools conference initiated by the University of the Western Cape. The school program was conducted in more than 30 schools in Cape Town and also included the Mizaj Questionnaire, was based on physical appearance, tendencies, and personality, and just to make it more simple for school children. The next one. Now, this is another questionnaire that we had in 2012 for the Lifestyle Advisor Program. Now, if you look here, you'll see some of the categories, like, for example, looking at the eyes, the shape of the eyes, looking at the veins, whether they are visible. Some of these things we found it wasn't really practical. So as we went on, we made changes. Again, yeah, even with the Lifestyle Advisor, we have extensive details or guidelines on how to actually assess the temperament. Today, the Institute has trained more than 5,000 health promoters associated with 126 clinics in the city of Johannesburg's health department. Right. The questionnaire included in the Unani-Tibb also just another sample, another example of different questionnaires that we had over the years. This book was published in 2015. Next slide. Right. Now, the current Mizaj, having gone through showing all the different Mizajes, the different questionnaires, this is the one that I think is the most current one that we have. And you can see now we've cut down some of the things such as looking at the shape of the eyes, such as looking at veins, because these things are always changing all the time. And of course, in South Africa, we have people with different color eyes, many of them. So all of this requires a lot of changes that needed to be done. So this is more or less the final version that you currently have on our website. I was also mentioned that on the website, we recently, all the old books that we have, we've also just included the latest current Mizaj questionnaire. Okay, these are the changes that we made. I'm coming to almost at the end of my presentation. Right, concluding remarks. And well, I appreciate the invitation from the Mizaj Research Committee for the opportunity to present the Institute's development of Mizaj Questionnaire. On a personal note, I would like to conclude with a humble request to share the Institute's efforts over the past 25 years. Review of the presentation has highlighted different efforts in promoting Persian Unani-Tibb both locally and globally. While reasonable success has been achieved, unfortunately due to vested interest and dominance of Western medicine in South Africa, the training of Unani-Tibb doctors is currently being phased out at the University of the Western Cape. I would therefore be honored to share the Institute's research and training material freely with no conditions, no reservations, both at the consumer and tertiary level globally to promote this holistic system of medicine. The Institute, together with academic support from Hamdard, Pakistan, Jamia Hamdard, and Aligarh, developed the training of Unani-Tibb that commenced in 2003 at both a 5-year undergraduate degree and a 1-year postgraduate diploma for medical doctors. Curriculum was reviewed in 2010 and also in 2018, which included the Institute's latest research on the respective training modules in a 1-year postgraduate diploma for medical doctors. This program includes 6 modules on theoretical principles, philosophy, etiology, pathology, diagnosis, therapeutics, pharmacology, pharmacy, and 5 treatment illness management modules covering 19 different systems and a research project. These modules can be included in a 5-year undergraduate degree together with the other basic and medical sciences. So, this is my concluding remarks that unfortunately with a very limited scope at the moment in South Africa, we are also trying to make arrangements of having the program instituted at some other university. But right now with COVID, a lot of things have been very difficult. So, and with my age of 76, I thought let me take this opportunity to see whatever has been done, we can share it with anybody that wants to see what we've done, to see if they want to include it, change it. No program is 100%. So even our one can be used, can be integrated. So that's my final conclusion. Of course, if you need any information, you can visit our website. And also just to mention that the Institute has launched its first online course, Take Control of the Health in Temp, which I'm pleased to mention that from the 350 people that are currently doing the course, okay, 80% of them are from local, but the other 20% are people who have signed up from 25 different countries all over the world. So in that aspect, I wish to thank God for His kindness. But things have been a little bit up and down, but I think we have achieved a certain amount. And of course, once again, I would like to really thank the Mizaj Research Group for the invitation. And as I mentioned, I would like to share things, but if any questions, I'm available to answer. Thank you.
Thank you very much, Professor Rashid Bhikha, for your nice presentation. I would like to invite all of the audience to ask their questions if there are any. Of course, me myself have some question, but I prefer to wait for the others if there are any question to be put it forward and asked from Professor Bhikha. Is there any question?
Assalamu alaikum. It's a pleasure, sir, always to listen to you. Very nice presentation. Dr. Danish Farg?
Yes, Dr. Farooq.
Yeah, if there are questions from the participants, and otherwise
Yes,
I
please,
will...
if you have any question, please ask. Yes, please, Dr. Farooq, have you any question?
Yeah. No,
Yes,
I don't
please.
have a question. Yeah. Actually, as I already said, it's always a pleasure to listen to Dr. Rashid Bhikha.
Okay.
And today we learned many things, and how he has collected all the material regarding Mizaj. And especially I appreciate the way they have made this Mizaj practical and clinically applicable in South Africa. And I must admit it right here that in India we are running our colleges from 90 years, almost from 90 years. We have institutionalized this training program of Unani medicine. But I haven't seen the way Dr. Rashid Bhikha and his institute has made Mizaj so much practical in practice. And I had an opportunity to see the curriculum of the University of Western Cape undergraduate program for Unani medicine few years back. And when I saw that curriculum, that was very voluminous. I must say they were this much thick. And the way they had prepared that curriculum and syllabus for the students, the practical aspects, especially of the Mizaj, how you can apply Mizaj in choosing your diet, how you can apply Mizaj in choosing the climate which is suitable for you. Even I found the mention of air conditioners there, whether a particular type of Mizaj should use the air conditioner or not. Am I right, Rashid Bhikha, sir? Yeah, I
Absolutely,
have
sir.
seen that, and that was really meticulous work that has been put into that. And in this presentation, it was I appreciate number one, the pragmatic approach of choosing the terminologies, especially using phlegmatic instead of blood, keeping in the all the situations in South Africa, keeping in view, and the Western mindset in view. So I think that was very pragmatic how you choose your terminologies. And second thing is the relationship which your institute has evolved between Mizaj, Akhlaq, and Sitta Zaruriya, which I think is missing in the classical test. But you have worked on that and prepared a relationship between these three, especially that triangle between Mizaj, Akhlaq, and Sitta Zaruriya. And as far as the questionnaire is concerned, it was very, I think, elaborate, and all the essential points were there. All non-essential, parameters have been excluded. That is also a positive point of that questionnaire. And more importantly, the clinical applicability which they have put in the use of that questionnaire is very appreciated, sir. And it was really pleasure listening to you today. But I have few questions like the subdominant type of Mizaj. Like as you said that a Mizaj has a dominant and a subdominant type. In fact, as I remember Ibn Sina, when he defined Mizaj, he said the Mizaj is the dominant property. When we say dominant, that means that is the Mizaj. There may be subdominant Mizajes, there may be combination of 4 Mizajes, but whatever is dominant, that is Mizaj. One thing. And second thing is what is the clinical applicability of that subdominant Mizaj. Once we have a dominant Mizaj, obviously that is going to affect predisposition to disease, that is going to affect the physiology of the person. So I am unable to understand please guide me about the clinical applicability of the subdominant Mizaj. So otherwise, overall, it was very nice. And I have always maintained one thing, that for clinical purpose, the questionnaire is no doubt wonderful, and we all must adapt this questionnaire. But when it comes to the research especially, and I think for research, there is one problem with this questionnaire, that is the inter-observer bias. There will always be a bias between the observer and observer. For example, when I judge Mizaj of a person, and another, maybe he is more trained than me or less trained than me, so definitely there will be an observer bias. So that is why an initiative by Dr. Mujahidi and Dr. Danishwar is here to prepare a scientific standard questionnaire. Otherwise, for clinical purposes, for applicability, I think this questionnaire is super fine, fantastic, and wonderful. Thank you very much. Thank you all.
Yeah. Maybe if I can maybe just respond to the aspect about the dominant and subdominant. We will invariably find, okay, now this was the hypothesis that I highlighted, to say nothing can be hot and cold at the same time. And also within the context of, let's call it creation, the perfection of creation. I mean, nothing can be hot and hot and cold at the same time. So this was the hypothesis. Now, over the years, alhamdulillah, we must have done about 10, 20,000 different temperamental evaluations. Now, the aspect about, okay, I know the original Canada method, Ibn Sina talked about dominant. But this concept about dominant and subdominant next to each other can give us a whole new dimension of a dominant quality. Right? And the dominant quality then so gives us perfect ideas about the predisposition to illness condition. Because people who are, say, I'm more accustomed to my sanguinous and phlegmatic. But with the dominant quality of moistness, definitely any conditions which have got a dominant moistness, they will be predisposed to. Now again, this is again keeping with the famous saying of Hippocrates, more important to know the type of person than to know the type of disease. So for us, we've been doing this for the last, alhamdulillah, almost 20 years. And even in our online course, right, aimed at consumers. Now the online course aimed at consumers, we've got 12 modules, philosophy, etc. But of course, at the consumer level, okay? And it ends up with, of course, we talk about temperament, we talk about humors, all the basic principles. And then it ends up with a consultation with one of our Tibb doctors at our clinic, okay? And to a large extent, most of the people who've done the course, I'd say 80% of them are quite accurate with the temperament. Right? But then also when you look so often, see the course has got two outcomes. Firstly, for young people below the age of 30, 40, to give them a lifestyle plan to stay healthy and well and delay chronic illness conditions. Then the other outcome is for those people above the age of 40, 50 who've got chronic illness conditions, based on their temperament, we then assess the predisposition to illness conditions based on our dominant, subdominant, and we also give them lifestyle advice. The whole purpose of this course is lifestyle advice. Lifestyle advice to stay healthy and well for those who are young, and lifestyle advice for those with chronic conditions, how to best deal with the conditions. Okay. Now even with them, about 10 or 20% people do get confused with the temperament. It's true. The one part I agree with you. The person who is doing the interview may have certain bias. The person who is answering the questions also so all of these things have to take into account. But again, when in the consumer course, when they do the consultation, but just looking at the conditions the person is predisposed to, already it will tell our Tibb doctor, hold it, this person's temperament is not very right. So then we ask certain questions, to say, for example, are you an introvert or are you extrovert? Okay? What are your conditions? And then, 9 out of 10 times, within a few questions, because the first thing they do for both interviews is to say, we want to just confirm your temperamental combination. Okay, so that's the first thing, because ultimately, Mizaj is the most important thing. Once you know the Mizaj, everything else just fits into place. So, yes, I do acknowledge the question, but alhamdulillah, we've been doing this for the last 20 years. And to a large extent, I think most of it has been validated. Well, one of the reasons I want to share information is that yes, we've done some research here, but we've got limited resources. But inshallah, whatever we have, it can be taken forward. The institutions you guys have in Iran, in India and everywhere else, you've got so much space to actually check what you've done to see how accurate it is. Because we're open to any suggestion, because nothing is 100%. So we are open to any suggestions, any improvement. But the idea is, at least we can just take what we've done and see how we can integrate it. And as you mentioned, Dr. Dar, that unfortunately, I've been in India since 2001. I've been there regularly with CCRE and with everybody, with all the universities, right? So unfortunately, we still haven't embraced this whole approach that we've done in South Africa. So it would be beneficial. Now look, I know, the founder of medicine definitely, even Sena, Hippocrates, they've been amazing. And there's so much more research to be done. But again, once this foundation is accepted and then improved upon, because ultimately nothing is 100%. So, but we're open to any more research to come. And unfortunately, in South Africa, the limited resources we have, and with the training now not being speaking around. So that I'm really hoping to share everything. And inshallah, then
Thank you very much, Professor.